So less than 12 hours to go for the world's biggest immunization initiative, and the two vaccines that will be used are both made in India. Prime Minister Narendra Modi had complimented India's scientists because this, he said, was a gift to mankind. These vaccines hopefully will also be exported in a big way in times to come. But just now, on day one, at those 3,000 facilities across the country, at least 100 people in every facility, they will be immunized the first dose. Take a look at the preparations, the last minute preparations that are on for that big immunization drive that actually the entire world is also looking at.
आज भारत एक नहीं बल्कि दो मेड इन इंडिया कोरोना वैक्सीन के साथ मानवता की सुरक्षा के लिए तैयार है।
The wait is finally over. Hours from now, India will kickstart the world's biggest COVID vaccination drive. Prime Minister Narendra Modi, who has been closely monitoring the development of the vaccines, will virtually launch the vaccination drive at 10:30 a.m. on Saturday. The vaccination drive will begin at 3,006 sites that will be virtually connected during the weekend launch. On day one, 3 lakh health workers who have been at the forefront of the COVID fight will get free shots. Each vaccine center will inoculate 100 people a day. Prime Minister Modi will also inaugurate the government's CoWIN app, which will be used for registration and tracking of vaccine beneficiaries. The centre has approved Serum Institute's Covishield and Bharat Biotech's Covaxin for the vaccination. The Union government has procured 1.1 crore Covishield doses from Serum Institute at a price of 210 per dose in the first batch. The total amount comes to 231 crore rupees. In the second lot, it will procure 4.5 crore doses. Similarly, the government has procured 55 lakh doses of Covaxin. Though the vaccine is priced at 309 rupees per dose, Bharat Biotech is donating 16.5 lakh doses, bringing down the purchase amount to 162 crore rupees. However, those who will get a jab will not have the choice of choosing the vaccine. A total of 80 lakh beneficiaries will get the COVID vaccine jabs in the first priority list.
In the COVID-19 pandemic, it was these healthcare workers who took bullets for people. And yet again, it is these healthcare workers who will be taking the first silver bullet of the vaccine made against coronavirus. There are rumors moving around about vaccines, but they will be the first ones taking the first jab so that people in the country feel confident about vaccines that are made in India. With Pradeep Gupta, this is Milan Sharma for India Today.
So before I bring in our guest, let's quickly cut across to India Today's Milan Sharma in Delhi and Vidya in Mumbai. Vidya, all set for the Rambad, as doctors in Mumbai are calling it, Rambad against the Rawad of Corona?
Yes, Gaurav, in Mumbai, the preparations have been full on. In the last many days, we have seen the dry runs going on, but it was approximately in the evening that we saw the mayor of Mumbai, performing a puja to see to it that nothing really untoward goes, happens in the entire start of the program tomorrow. Chief Minister Uddhav Thackeray will be at the Bandra Kurla complex, the entire unit that has been set up for the vaccination center there. Although apart from the BKC area, there are 8 other centers in Mumbai where there will be vaccination. Almost every place has been prepped up already. The barricading of those places so to see to it that nothing untoward, no law and order problem really happens. And to see to it that approximately 4,000 people who will be vaccinated do get their vaccination on the first day itself without a hitch.
Milan, in Delhi, vaccines have already arrived, already distributed, and what are preparations? Are there last minute preparations that were still on till late this evening?
Right Now, last moment hectic preparations are going on so that everything goes on smoothly in the morning. It's going to be exactly like an electoral process where in the morning the boxes of the vaccine will be shifted to the designated centers. They'll be carried by an SDM, subdivisional magistrate level or divisional magistrate level officials. There'll also be officials of the health ministry at the union level along with the Delhi government officials. Now, the vaccines have to be sent both to private as well as government facilities. We know for now at 81 sites, if we talk about Delhi, about 6 vaccination sites will be done with Covaxin, which is India's, made in India vaccine. And the rest of the sites, the 75 sites, will have Covishield vaccine that will be administered to the health workers. For now, we also know that after the Prime Minister's address is when the hospitals will begin administering the vaccines. Union Minister Dr. Harshvardhan will visit AIIMS Hospital at around 10 to 10:30. We've also heard that Delhi's Chief Minister Arvind Kejriwal will go to a Delhi government hospital, that is Lok Nayak Hospital, which is known as LNJP. So yes, there are going to be inoculations done, and it's definitely going to be a very big day for the entire country.
Okay. Milan and Vidya, for the moment, many thanks. I have Dr. N.N. Mathur, Director of the prestigious Lady Hardinge Medical College, joining me on the broadcast. I also have Dr. Rajesh Parikh of the Jaslok Hospital, Mumbai, joining me on the broadcast. Dr. Mathur, all set for tomorrow. How many doctors and other medical staff are likely to be immunized at the Lady Hardinge Medical College? And is this entire process completely voluntary, sir?
So the preparations are in full swing, and the vaccines have arrived. And at Lady Hardinge Medical College, as in other hospitals also, we will be inoculating 150 participants in one sessions. If the sessions later on will maybe multiplied by 2, so then every day there will be 300 who will be inoculated. And this is the preparation, which has already started. The vaccines have arrived and kept in the ILRs. And tomorrow morning, after the Honorable Prime Minister launches the program, which is the largest in the country, in the world, of the vaccination, will the vaccination at all the centers immediately start.
Dr. Parikh, does it make a difference whether somebody gets the Covaxin or Covishield, and does the receiver or the doctor decide, or the government decides? Preparations in place in Mumbai, sir?
Yes, as I've just seen at the start of your program, preparations are in place beyond what you'd normally expect, with prayers and all of that. And I guess the allocation of the type of vaccine, which was your second question, will depend on availability. Your question of whether it makes a difference, that's what you're going to find out. I don't think these two vaccines have ever been compared on a head-to-head trial. And so while frontline workers are the first recipients of the vaccine, we could also be considered as the first participants in a trial to see how these vaccines work.
Okay. Dr. Mathur, are you getting a jab tomorrow or in the initial phase? And do you have a choice whether it's Covaxin or Covishield, or you're okay with whatever happens?
No. Whether anybody or me or anybody gets the vaccine when, it is not up to me or anybody. Whosoever is selected is sent the SMS on his mobile, and then only he has to go to the center to get the vaccine. It is not the vaccine, the person's choice or the vaccinator's choice to pick and choose a person or his vaccine, or the person to choose his vaccine or the date or time. Everything is decided through the app, and the message is received by the individual on his mobile, and then only he has to go at a designated place at a designated time to get the vaccine. And once he gets the vaccine, the same vaccine will be given to him after 28 days, and for that also the time and the date will be fixed by the app.
Okay. Okay. Does it make a difference, Dr. Parikh, whether it's 28 days or, as a new study in the United Kingdom seems to indicate, perhaps even longer, 28 days or 12 weeks. In the UK and the US, perhaps they're experimenting with trying to get more people vaccinated in the first round instead of giving 2 doses to the same sets of people. What's better in your appreciation, Dr. Parikh?
I think it's not a question of my appreciation. I think what's better in terms of what the data indicates. And I think our government has made a wise decision based on the data that is amply available across the world, that there will be 2 doses, 28 days apart, and mind you, of the same vaccine. That is the data we have, and that is the policy our government has chosen to follow. In the United States and in the United Kingdom, because of multiple other pressures we needn't get into, but most of these are related to logistics, they are looking at what it will be like based on certain assumptions to see if delaying that gap, if having that interval stretchable up to 12 weeks makes a difference. And also if you give the first dose of one vaccine and the second dose of another similar vaccine, the mRNA vaccine in that case, does that make a difference? This is something that is not established. It is being looked at. And I think the policy followed by the Indian government is the one that is based on evidence. And that at this point in time, at least clearly seems to me to be the more prudent and wiser choice.
Okay. Dr. Mathur, if I were to come to that point about this drive being completely voluntary, is this voluntary? Has everyone at your hospital said yes? Are some who are still hesitant? Because if doctors and healthcare workers, nurses, hospital staff, if they get the vaccine, it's a morale booster for the others also. Has anyone said yes? Has anyone said no? And are you also monitoring how they react to the vaccine at your hospital apart from the CoWIN app?
No, it is absolutely voluntary. No pressure from any side. No monitoring about their behavior. Nothing of that sort. No pressure, either direct or indirect, on an individual to take a vaccine.
Okay. And in the United States, I was just reading a report. There were major glitches, Dr. Mathur. I'm coming to the government aspect of whether being, the niggles that could come in this entire process. United States wanted to immunize 20 million people. They only succeeded in doing it to 2 million people. Vaccines weren't reaching. There were various other niggles that were taking place. Do you fear some of those niggles here? There were computer glitches that people were reporting very extensively in the United States of America. Do you apprehend some of it here?
We have done our preparations well at the governmental level as well as at the periphery. The preparations had been the dry runs had been there, and all the preparations have been done. During the dry run, the processes have been evaluated, and whatever were the gaps have been filled. So much so that today we have received, one day before, the vaccine shots which are to be given tomorrow or for 2 or 3 days into our hospitals. So everything is running quite smoothly. Of course, when the things are of this magnitude, some computer glitches here and there or something can happen, and they will be immediately rectified if anything happens like that. But so far, so good. It's running quite well.
Okay, Dr. Parikh, you apprehend niggles in terms of how the CoWIN app will perform, how will it monitor people, how quickly will this entire process take? So far, we are told it will take about half an hour for the process, half an hour for about monitoring. But you think there could be issues, and perhaps not in the bigger centers, but in smaller centers?
Yes, undoubtedly, there are likely to be issues. Let's keep in mind that nothing on this scale, on this monumental scale, in this short span of time has been attempted anywhere in the world. But in terms of the earlier issue you raised, it's important for us to understand that there are differences in the system that's being used in the US and in India. The two major ones, we needn't go into the minor ones, the two major ones, one are concerned with the type of vaccine, They're using the mRNA, which needs to be stored at minus 70 to minus 80 degrees Celsius. That
Minus
poses
70.
certain nightmares, and that's a potential problem. But more important, the US has not conducted any dry runs. We have had dry runs, and that's a very, very big difference. And if I may, I'll just highlight a small issue. A colleague of mine, a physician himself on the East Coast in the United States, that day called me. We've just written a book called The Vaccine Book.
Yes.
About vaccines, and he was aware we've written this book because it's launched in the US as well. And he had a concern, and he says, I've just been informed that I can go and take the Pfizer vaccine. What had happened is a truckload of the Pfizer vaccine had come to his hospital. They had assumed that this hospital would have the cold storage facilities, which they did not have at that lower temperature. And so the thing was, things were in the truck, and they were out of range for about 10 hours. And then the hospital decided, let's just give it to everybody, first come, first serve, because otherwise the vaccines will get wasted. And so he wanted to know that if it was outside of that latitude, whether it was okay. I reassured him it was fine. The point is that these kind of things have occurred in the US because there were no dry runs. I doubt we'll have anything of that magnitude in our country.
Okay. Well, that confidence is heartening. The countdown, 11 hours, 38 minutes to go. Dr. Parikh and Dr. Mathur, many thanks for joining me here on India Today. I visited Delhi's Lady Hardinge Medical College earlier this evening to take a look at preparations. And there was tremendous enthusiasm amongst doctors and healthcare workers at the hospital. They were very keen. They were looking forward to this entire process, waiting for that. How does this entire system work? The CoWIN app, the dry runs, the last-minute tests. Take a look at this report. It's the world's largest immunization initiative, and we are at Delhi's prestigious Lady Hardinge Medical College. The countdown has begun for the immunization process, and this is where the teams are ready. There is security that's already in place. The CoWIN app at this Lady Hardinge Medical College, just as people walk in for immunization, this is where they go for registration. And with us is Dr. Professor N.N. Mathur, the director of the Lady Hardinge Medical College. Professor Mathur, the countdown has begun for the immunization process. Are you all set, sir?
Yeah, so the vaccine has finally arrived, and we are all set to vaccinate the healthcare workers to start with. Honorable Prime Minister will be inaugurating the program tomorrow in the morning, and then the vaccination will start.
Sir, how many people get vaccinated here in the morning, and what's the procedure, what's the process?
So the process is that first they enter from the gate that you have seen. They are verified, their temperature is taken, and once it is confirmed that the person who is entering is the same as who is registered, he comes here, and we have a data entry operator with the CoWIN app, and in the CoWIN app his name will be there, and that is verified, and he's asked few questions, and the form is filled online. It goes on the app. He's given a token. Once the verification is over, he's told about the his consent is taken. He has given the form of any adverse reaction also to fill in case there is anything happening in the after the vaccination.
How many people do you intend to vaccinate in a day?
So in one session we will vaccinate 150 people, and that will be followed at every place. So one session will have 150. If there are two sessions going on simultaneously, then in a day we will vaccinate 300.
And we have about 4,000 odd here?
We have around 4,000 people registered, healthcare workers registered from Lady Hardinge. Yeah.
And all that will be monitored on his mobile phone. Dr. Mathur, for the moment, many thanks for speaking to us here, and wish you all the best, sir.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.